To order, the first item on the agenda under new business are the minutes of the December 4th meeting for review and approval. Do we have a motion to accept the minutes as?
Motion to accept.
Thank you. Second?
I guess I'll second even though it wasn't here.
Okay. Thank you. Minutes approved. Next item on the agenda is the monthly development services report submitted by Matthew Sheehan. Hi, Matt.
Good evening, everybody. As you can see in the report I submitted, since the last time we went in November, we have 8 new businesses that started in the city of Lowell. We had one closure due to a water issue. We had a few failed restaurant inspections. I'll draw your attention to the very last one on my report, which was from the Outback Steakhouse. They had a food illness complaint. What happened was 2 people got sick from their French onion soup. So my team went in. We did a full food inspection along with some paperwork from DPH, and it turned out to be, it was operator error because their French onion soup is mass-produced, so it comes in frozen, they thaw it out, they reheat it, then it's served to the public. So if it was something with the French onion soup, I'm sure we would have seen something on the news, you know, with a lot of people getting sick. That being said, you know, they didn't have any thermometers to take temperatures of their food, so myself, 2 of my team members, we went in, we made a corrective action plan with the Outback. They are doing that corrective action plan as we speak. One of my team members was just there on the 30th of December. They passed their food inspection, but one of my team members will be going back week to week for the next 30 days, just to make sure that, you know, they are sticking with the corrective action plan that we went over and just what, you know, the Outback Corporation puts forward and what they're supposed to do when they're opening, their mid-shifts, and their closing procedures.
I like that policy of when there is a food illness complaint to return.
Oh, absolutely.
Yeah. I mean, I don't think we, you know, I think that's a good idea, the reinspection.
Yes. And we really, we sat down with management from the Outback for quite some time. We were there, like just me and my team ourselves, we were there for well over 2 hours.
Good.
And I mean, they know that, you know, it was on them. Like, they messed up and, you know, they weren't doing what even Outback tells them to do. So, like I said, they're on the straight and narrow now, and I hope that they stay that way, because I told them in no uncertain terms that if somebody else gets sick from their food, that they will be here with me to answer to the board. So it was well perceived, and like I said, they went back on the 30th, and they went back, I want to say at the beginning of the week. So things are highly improving over there, and it's good.
Good.
Does anybody have any questions about this?
I do about something different, which is the 7-Eleven.
Bill?
Yes.
Sorry, I have a question about the 7-Eleven. We've had, prior to your being in this role, we've had 7-Eleven. There's 2 of them. At least one of them's been here twice in the last few years. I don't know if this is the same one or a different one, but could you just take a look further back in this history and make sure it's not the same one that's been here twice in the last 3 years?
Yes, sir. Absolutely, yeah.
Thanks.
I'll get back to you on that.
Also, Matt, could you check, because I don't know if this is the same 7-Eleven that had problems with their dumpster, but they also may have switched owners since some of the issues that we had with them before. I don't know if this 7-Eleven switched owners on Mammoth Road.
Okay. No, I'll look
Thanks.
into that. I'll get back to you. I'll let you know.
In retrospect, I think it was actually they were selling cigarettes to minors. That's why they were here. So that's what it was. So I'd still take a look, make sure, but I expect it not to be that. Thank you, though.
Yeah, you get nervous when they're selling expired food.
Oh, absolutely. Well, I mean, you know, we go into every convenience store, and sometimes there are items that we do see. A lot of it's dry stuff, surprisingly, you know, cereals, things like that. But it's a point where if we find one item, we just stop, we go speak to whoever's in charge, get the owner on the phone, and they have to go through the entire store and then we'll come back. Because because there's no rhyme or reason for that. Like, they should be turning their inventory over all the time. If they're not selling it, they need to go through it.
Any other questions from the board on the inspection report?
Thank you, sir.
Thank you.
Yes,
What?
the road update or whatever.
So Matt, for discussion, after the development services report, inspection report, there's an item on the agenda related to rodenticide.
Yes.
Okay.
So in regards to rodenticide, just to give you a quick update, there are currently 75 deployed smart boxes in the city, which do not use rodenticide. These boxes are baited with a provoke rat attractant, which is kind of like a faux peanut butter. That's the only way I can explain it. It's gel-based, and these boxes actually zap the rats. Like, once they go in, they get zapped, and then it sends a signal to Martin Pest. They come in, they pick it up. So there's no poison in these boxes. Martin Pest uses bait stations called Protecta Evo Express stations at residential portions in the city contract. In these devices, they used contract blocks, which is a rodenticide. 2 of these devices are deployed at the residential homes, and they check them every week for 3 weeks and replace the bait is needed. As of this Saturday, on the 11th, there will be no more traps deployed in the city. If the ordinance passes, Modern Pest will switch to what they call snap traps. There will be no cost difference in the contract that we have with Modern Pest. Now, switching over to Banner Pest, which operates inside the schools, Banner Pest operates inside the schools, and they are switching to a cadet all-weather box. This box contains cholecalciferol, and I actually hyphenated that so I could say that, and I practiced 5 times today saying that word, as the active ingredient in the traps inside the schools. I'm told that there is little to zero risk of passing this along to other animals. So, like, if a rat or a mouse kind of got out of the school, animals wouldn't get sick. I've read up on the rodenticide, and I guess, from my understanding is, if a rat got out of a trap and a bird, wild animal, something like that, ate it, it in turn transfers it to them, and they get very sick. So, if an ordinance passes, my team, myself, we'd be in full support of that.
But as currently is, they're all being eliminated anyway from the city contracts.
Yes, sir. Yep. We will not be, there will be, as far as the city's concerned, anything that we use with our 2 contractors, there will be no more rodenticide.
So the 2 contractors are Banner and Martin Pest?
Modern. Modern, M-O-D-E-N, Modern Pest, and Banner Pest. Banner Pest is the one that does everything inside the school.
We're familiar with Banner.
Yes. Yeah, Rick does a good job.
Okay. Any questions about that? Did anyone else want to have a word on the rodenticide? Okay. Was that the issue you were here for? Okay.
So, Madam Chair, I just, so the reason that this came up for the board was because the city council is bringing this up and they'd like to support it. So they wanted this brought to the Board of Health so that the board could take a vote to whether we're in favor or not in favor, so that the city solicitor could write an ordinance to support for the city to take rodenticide out of all of the boxes and not have it in the city. And then also to make a recommendation for the local businesses not to have rodenticide in the boxes that they put out, because obviously we don't take care of all of the boxes within all of the dumpsters. And then also that maybe we could have some kind of a campaign within social media for the local businesses around rodenticide, and maybe some of our advocates can help us with that social media campaign.
So an educational campaign?
Yes.
To them around
Yeah,
that?
right. As to why it shouldn't be, because the, it's not good for the wildlife, and the wildlife also, I mean, I can tell you that 2 years ago, we used to have 2 hawks around the daily school, and they eat, mice and rats, and I used to watch them take them up and, take care of some of those things. And we don't have them anymore in the neighborhood, so it is a sad thing that you don't see the wildlife around. Never mind the fact, having a dog, and I walk him at 5:30 in the morning, if, he got hold of something, and we know how many people have pets in the neighborhood, so.
Dr. Galvin?
Well, just a clarification, are we being asked to recommend that it be banned from the city entirely, or we recommended the city not use it for their contracts, or are they asking us to ban it themselves, in which case don't we have to have a public hearing?
Nope, you could, I think what we're asking is if you could make a motion for the ordinance to be written. I think right now, all we can really do is ban it from our contracts and recommend that recommend a campaign for education for the local businesses and recommend that they not use it.
So we can't create an ordinance that would require private businesses to ban it.
Right.
We just got rid of cat.
Kratom. I mean, that's my understanding, that,
I mean, if the city council, we can write something and we can present it to the city council if the city council wants to try to take it an extra step. I'm not sure if there's a way by looking at the box, if you can tell what's in it or what's not in it.
I mean, to our point, I would work with Director Golden and the solicitor's office to come up with some kind of educational pamphlet or just a piece of paper, like when we go do our restaurant inspections, convenience store inspections, once the inspection's over, just hand this to them saying, hey, there's a new ordinance in the city, we're looking to get rid of rodenticide. So could you please pass this on to, your pest control company?
So I'll make the motion to support that city council's decision to not use it as in city contracts. Is that what you want? Is that what you wanted to say?
yeah, I
There's
guess,
3 parts to that, right?
what's that?
There's 3 parts to what you're asking, right? So the first.
Correct. Remove the rodenticide from anybody that the city has contracts with. An educational campaign through DPD to the city businesses. And recommend that any city businesses or residents not use rodenticide.
There you go, that. I'll make that motion.
A second.
Thank you.
And we'll leave it up to the law department as to whether we can mandate that into the private businesses.
Right. And I believe the law department does have a couple of ordinances from other cities and towns that have already put this in.
Okay, great.
Thank you, Matt.
Thank you, everybody.
And thank you guys for coming.
Thank you.
All in favor?
Aye.
Aye.
Okay. The next item on the agenda is the Tobacco Control Monthly Report submitted by Caesar, Program Director. I just had a question about the public notice of the new kratom regulation. So in Caesar's report, he talks about the regulation taking effect January 2nd, and the legal notice in the Sun, and the new regulations available, and that the educational visits will begin in January. So I guess the question is, do we have any idea when the date of fine initiation or the completion of his educational tour will be, or is that just pending?
No, I believe that he had mailed a letter to all of the tobacco stores, so I think that was why he worded it that way. So if it was a tobacco store, he was going to start fining, but if it was a convenience store, they would need more education. So it depended on the where it was found.
Okay, well, it just, so when would the fine start?
The fining could start as of January 2nd.
Oh.
Right, yeah.
I assume if he's going back for a second time.
Right. I mean, I heard him on the phone talking today to people about it, so, yeah.
Okay.
He's already getting calls from people who are reporting places that he's going out to, so.
Great.
Yep. And I have had a call from Drake and Chelmsford for the ordinance, and I know that the Drake Board of Health already met in December, and I think the Chelmsford is the third week of January.
Okay.
The expectation of it as well.
Thank you, Director Golden. The next item on the, any other questions on the tobacco control report? Okay. The next item on the agenda is the Pride Star Trinity overdose report for November. Any questions? Next item on the agenda is the, under old business, the review of the EMSL analytic report on the Pawtucket Memorial School, which looks good in terms of spores. There's only one classroom that's remotely close to the level of concern. 1083.
Lisa, do you know if the air chiller went in?
I believe the last part of the air chiller I heard on the city council meeting will be done in 2 weeks.
Questions? Okay. And they'll continue to do monthly.
I believe in the email, the next one is either the 9th or the 11th.
Of January.
January, sorry, yes.
The next item on the agenda is the Cashins and Associates Air Quality Report for LHS, which looks very good, except for a little dust in the 80s building first floor stairwell.
Don't look that close.
It's fine. I'm sorry, is your mic?
Oh, I'm so sorry. Talking to myself here. Wasn't there some in another area too, Joanne? I thought I read that there was one like in the, it was called the Heart, maybe where two of the buildings met, like where there was a lot of foot traffic.
The only one I
I
picked
thought I
up
read
was,
that.
of course, now they're calling them different. The
Yeah.
80s building is now Phase 3,
I
I
know.
guess.
Well, maybe I'm just not, wasn't looking at the right thing.
There was stairwell L on the first floor of the 80s building that had a dust, 329 milligrams per cubic millimeter.
Yeah.
And the standard was 150.
Okay,
But I don't think I saw any other.
that's
app-
okay. I'm probably just,
There was one the last time in the vestibule that they had to fix, something the last time.
That's what I'm-
So there was one in the Hart vestibule or something like
Okay,
that,
yes, that's what
right?
it was called.
Was that what it was? Yeah. Okay.
Yeah, that one I called the project manager on, because there was no mention of how they remediated it. Okay. The next item on the agenda is for discussion, the body art regulation fees. Apparently, we had a discussion about raising the fees, but that, of course, needs to go to the city council. And so, do we need a motion or a vote? No?
Do we agree upon this? I don't remember what the number was, but I
So-
remember talking about it.
Go ahead.
So it was voted and it was put into the regulations, but we missed the step. Somehow the step was missed to bring it to the city council to vote on it. So when we went to Bill, the tattoo artist and the microblading, we can't actually bill them the rates that are in the regulations. So I just wanted to bring that to the board's attention. We're still billing them $250 and $250 for this coming year, and then it will go to the city solicitor. He doesn't need anything from us to bring it forward, but I just wanted to let the board know that those rates, if it's approved by the city council, won't go into effect until '26.
And it'll be 250, 500.
Correct. And I believe when I checked with the secretary, it's 500 for the establishment and 250 per practitioner.
Is that fine? With you?
Yeah.
Okay.
I think that's what we agreed upon. Perfect.
Okay. Next item on the agenda is the public health accreditation update from the director.
Yes, so I just added, so we're going through the accreditation process. So we did have a stakeholders meeting, which means that there are people from each division within the health department. I believe there are about 10 people. Matt was kind enough to come from Development Services to come onto our team. So we've had, I believe, 2 or 3 meetings, and we came up with a new mission, vision, and values. So the people who are helping us move through this process thought it would be nice to bring it to the board and have the board's input to see if there was anything you wanted to add, and have you vote to approve these, if we could move them forward. We're also doing a lot of work for the accreditation. When I came to you last year and brought this to you, it was supposed to be a 5-year process, but we will be submitting our application before the end of this year. Just a little bit of an overachievement. No, I have some great people doing some work on it, so that's why.
So, at the risk of nitpicking the mission statement,
No, that's okay, go ahead. We've gone back and forth 1,000,000 times on this, so it's okay.
I'm sure this is in your vision and your, the values and all of that. But, so the mission is to improve the health and well-being of the people of Lowell. So would you think about maybe saying is to promote, protect, and improve the health? I think improving the health sort of leaves out, so it says that we need to improve the health, but we also sort of have to protect and promote the health without, we might not be able to improve some parameters, but I feel like it better defines the mission.
Nope, that's okay, because I can bring it back, because we have a meeting within a week, so.
Did 100.
And I can tell you that we did struggle with words.
Yeah.
So, and it is true because we have multiple nursing homes, and some of those people are going to, we have an aging population that are
For those,
in the state that they're going to be in. So, right. Yeah. So it's true. Yeah.
and,
right.
and you do mention it's not just the people of Lowell, it's the people of Lowell and the visitors, but I do see
Right.
that you have that in your
Correct.
values.
Yes.
Thank you.
Yeah, I'll bring it back to them. Thank you. No, that's why we bought it. More eyes are better.
Unfortunately, I wrote a lot of those.
I thought it was perfect the way it was, but
Just for the record. Good, your mic's off. Okay, the next item on the agenda is the departmental and divisional reports and updates from the director.
I don't really have anything to point out unless you have any questions. At the very end is the mobile health unit, which was the school health unit. So UMass Lowell and Lowell Community Health are have been working for a long time on this mobile health unit. So it's an offshoot of the school health. There's a clinic at the high school and the Stocklosa school, and they've been wanting to put more clinics within the schools, but this is going to be more of a mobile clinic that's going to be able to go to 6 different schools, and there'll be a nurse practitioner on the van that will be able to do physicals, see sick kids, and do vaccines for the kids in those schools.
This is not instead of a nurse being in the school.
Correct. Correct, yep. And then so Lowell High will still have their clinic and the Stocklosa will have those. And then this one will go to 6 rotating schools. And it will be anyone who is a Lowell Community Health patient or wants to sign on to be able to be seen here.
Maybe I missed this. Do we officially have a medical director yet?
The contract has been signed by the medical director, and we're getting ready to get signatures by everybody else, so don't jinx me.
Okay.
Is it too early for a name?
Yes, just a little bit. I don't want to be jinxed. I see light at the end of the tunnel.
Okay. I did just have one question on the syringe collection program.
Yes,
The total of syringes picked up while in the community for 2024 was 15,547. Do you have any recollection of what the total for 2023 about was?
you know what, and I was kind of curious about that myself today, and I never jumped on to look, but
Okay, I was just curious, like. I have no questions on the TB section of the public health report.
and Nicole and Gisela have been looking at this, and I think it looks just a little bit different, so they've been playing with it a little bit.
Any questions or comments from the board? Do we have a motion to adjourn?
I will make that motion. And
Second.
thank you for a well-run, efficient, quick meeting.
You're welcome. Happy New Year. Happy New Year.
Happy-
Who was the second